This
All right,
conference will now be recorded.
perfect. And so just a quick reminder, if you're joining us a little bit later on in this, just please make sure to go ahead and hit mute. Throughout this presentation, we're going to have Megan from the ADAPT team presenting on the new toolkit. So thank you all for coming and joining us this afternoon/morning, depending on where you are. My name is Allie Burrell, and I'm the ODMAP program manager. And as we continue to grow and develop, we understand that there's additional needs and resources for our ODMAP users, so that way they can continue to implement new strategies and find different ways to share that information with folks. In a way that is both abiding by the policies and procedures about data sharing, but also as a way to make sure that the area that you guys are partnering with or represent are understanding about what's going on in as real time as possible. And so one of the things that we've continued to hear about over the last few years has been, how do we tell people on social media about a spike alert, after a spike alert in our area, or just sharing information as much as we can, so that way we can inform our community. And so from that, as we are looking at going into our 6th year here in the next few months, we thought it'd be a great idea to partner internally with ADAPT on a social media quick guide to help guide our ODMAP users in how to utilize this information in a way that uses smart, stigma-free messaging, but it also provides enough information to community members to understand what's going on, but not encourage drug seeking behavior in a way where if there's a bad batch coming through, that we're kind of narrowing in where folks can find that specific drug. So again, what we did was we reached out to our partners literally down the hall from me in our Reston office, ADAPT, to leverage their area of expertise and see if we could create a guide that would help us help our ODMAP users walk through creating a social media presence using spike alerts and things of that nature. So we reached out to them, kind of came up with this guide, and then brought in a few of our stakeholders to look through it and provide some guidance. And they were a great group that provided some understanding and different things that we didn't think about to be able to come up with this version that Megan is going to run through. So that being said, Megan, I'm going to introduce you real quick and then I'll hand it over. That way we have time to answer any questions from the group. So just to preface, if you guys come up with any questions, please feel free to go ahead and put them in the chat as this goes along. I'll monitor and make sure that we can come back to them at the very end. But I do want to make sure we have time for Megan to go through the different toolkit sections and make sure that we can go over them fully and then address questions at the very end. So Megan Erickson is a research analyst with the Washington-Baltimore HIDA and ADAPT. ADAPT stands for a Division for Advancing Prevention and Treatment, and they serve as the Training and Technical Assistance Division for Substance Use Prevention Programming for all HIDAs. We also have joining us today Rebecca Bates, who serves as the Technical Assistant Program Manager, and also Dr. Laura Papard, who serves as the ADAPT Director. So with that being said, Megan, I'm going to go ahead and hand it over to you. And again, if you have questions along the way, please go ahead and feel free to put them in the chat.
Thank you so much, Allie, for getting us started. So let me just start off with the goal of the guide. The goal of the guide is to assist ODMAP users in preparing to share ODMAP data, specifically via social media, to help inform their community members of immediate overdose threats and to encourage action and engagement in response. Can everyone hear me? Sorry, I just saw a chat from Trevor. Allie, can you still hear me?
Yes, we can hear you.
Yes, I can hear you.
Okay, so that might not be a widespread issue. Anyway, real quickly, I wanted to give a huge shout out and thank you to the partners we met with last week for providing us with their feedback and impressions while we finalize this document. So I'm just going to share my screen here and give us a high-level overview of everything that's included and how you can use this guide. So our first section is sharing ODMAP data on social media. This goes over the goals of the guide again, as well as how ODMAP data is commonly shared. The most common way to share it is through spike alerts. And we do note that there are specific limitations to sharing ODMAP data, which we outline a little bit here. And we also link to a presentation that outlines that in more detail. But like I said, generally, when ODMAP data has historically been shared, it's been through spike alerts. So usually a spike alert message will include the date of the alert, the geographic region of that spike, local resources in your community, and then any relevant contextual information such as safe reporting laws. So our next section is really on developing a social media strategy. So on the left, under this resource box, we have a few outside resources with direct links that you can click on that can really help you start developing that social media strategy. We also made sure to include implementation considerations and role responsibilities. So these are various things and questions to think through when you're looking at your social media strategy. So that could include who's going to post content, where are you going to post content, such as what platforms will you use, what content will you include visuals, hashtags, everything like that.
Hey, Megan,
So
really quick, 1 second.
Yes.
For those of you asking about zooming, Megan, would you mind zooming in a little bit if we need to scroll over time, just so folks can read it? And then also on your screen on the right-hand side, there should be a little zoom feature for you guys to zoom in depending on how much you would like to zoom in, just as a heads up. And then please make sure you guys go ahead and mute yourself throughout the presentation. We do have some feedback in the background.
I'll try to zoom in as I go so nothing gets cut off. So I'll try to zoom in on this section I'm specifically talking about if that would be helpful. And this will be sent out later. Okay, so the next section is on sharing ODMAP data effectively. So this is really pulling some more general communication science. So right here with these bubbles, we have a formula that can be used to guide just in general social media content and posts. So it starts with leading why what you're posting matters, identifying the specific problem, explaining how the problem works, and then always pointing to specific solutions as a conclusion. So below there, we've included an example of that formula being used in all of these boxes underneath. And then the last part of this section lists some local resources and key information that you would consider including in your social media content posts. So these are things like substance use services and resources, community-based resources, safe reporting laws, where and how to obtain naloxone, and then also signs of an overdose. And then this very final paragraph here is discussing the language used in your messaging to avoid stigma. So really the bulk of the guide is in this final section, crafting spike alert messages. So we've really broken this down between immediate release and after action reports. So an immediate release would be releasing content immediately after receiving a spike alert notification, whereas an after action report is really designed to highlight the work that had been done in response to a spike alert. And then we do note here that regardless of the message that you're putting out, the information should really be kept at a general level. We do not recommend including specific overdose maps or location data that goes more specific than a county. And then we also make a note that using tags and hashtags across various platforms can increase your engagement and reach with your audience. So this next table we have is really looking at the common spike alerts you'll receive and the corresponding responses with action items and resources to consider including. So really the spikes fall between occurring in your specific geographic area or a nearby geographic area. And so again, the resources are similar to what I mentioned above. So that would be specifically where can I obtain naloxone, where can I get naloxone training, substance use support in the community, treatment locators. And then we also note that a spike in overdoses in nearby geographic areas may serve as a warning for your specific community. So below here, we have several templates that are meant really for you to easily be able to use and plug in your own specific information. So we start this with the after action reports, and this is divided by a press release and across social media, which is designed to link to the press release. So a press release would really be when you're thinking about newspapers or blog posts, things like that, that are really, again, designed to highlight the work that had been done in response to a spike. So really, you'll notice here that there's brackets, and that's where you can fill in your own specific information. So you can fill in the name of your organization, the date of the spike, as well as partnering organizations, key actions and resulting outcomes, and then always at the end linking to resources. And then, like I said previously, social media, you would provide a link to this. So then we move into the final section that includes various different platforms, because this will look slightly different by platform just by nature of the limitations and layout of the different platforms. Some allow pictures, some do not, some have limited text capability. So these are designed to really show you templates in the visual format. So we've included Facebook, Twitter, LinkedIn, Instagram, Nextdoor, and text alerts. So while they look a little bit different, the content is very similar. So it always starts with, let's zoom in here. There we go. So it always starts with identifying the spike and then providing recommended actions. Again, that's the lock zone, treatment organizations, harm reductions, things like that. And then linking to specific local resources. So you can provide websites, phone numbers, and then you can also consider visuals and tagging partnering organizations, law enforcement departments. So the content is the same, like I said, but they will look a little bit differently. Obviously, Twitter will be shorter, and the audiences might be tweaked a little bit depending on the platform and who's following you. And each platform obviously has different demographics, which we linked to some of the resources previously, have more of that breakdown for you to consider. So LinkedIn is obviously going to be more geared towards your professional network. And then we also included these three we recently added just based off our discussions last week. So we have Instagram, which is very not text heavy, image heavy. Nextdoor, which I had only learned about recently, which really highlights things in your specific community. And then also text alerts. So that is all of the content I had. And before we move on to opening for questions, I do want to put a plug in that ADAPT is hosting our 2022 Hideout Prevention Summit this October 6th. So that's just around the corner. It's an all-day virtual event that's completely free. And the title of the summit is Mind the Message, Equipping Communities with Evidence-Informed Communication Strategies for Youth Substance Use Prevention. The purpose is really to equip communities with knowledge and tools to support conversations with youth and changing social mindsets towards substance use prevention. We'll dive further into some of the concepts that are included in this guide. So if you think it would be helpful for you, I highly recommend attending. So I will open for questions, and please let me know if you want me to go to a previous section or zoom in on anything in particular.
And Megan, we did have one hand raised a while ago. So I guess Ned, just want to make sure if you did have a question, we can open that up to you.
Sorry, no, I was trying to do the thumbs up.
No worries. And I know that not all of you have potentially used GoToMeeting, so thank you guys for going with the flow on this. It's not necessarily always the most user-friendly platform, but we got a good amount of people in versus Zoom and everything. This is just what we use at WB HIDA. So go ahead and throw out the opportunity to ask all those open-ended questions, and just a thank you to Megan for running through this, but we'll go ahead and open the chat for questions, or if you would like to unmute yourself, feel free.
Can you go over the data use restrictions again in social media? What specifically cannot be shared within the spike alert?
Yeah, so your question's two-pronged, I think. For the second part, for spike alerts, what I had mentioned was not sharing specific location data. But as far as ODMAP is concerned, just in general, the data is owned by the agency that submitted the data, so everything should be outlined in the participation agreement. So it's always recommended that if you're in doubt, ask and don't share. Allie, if you could speak to that more specifically, that could be helpful.
Yes, that's correct. So because the agency, maybe you're looking at a regional spike. I know here in Northern Virginia is one of my favorite examples. But we had a regional spike that was going on. And so the county that was the one putting out the social media message, they only reported information that they were allowed to from the other areas, and it was reported in aggregate. So it was looking more at that regional approach. So that being said, the reason why they were able to share that was because they were given that specific permission to share that information, and it was reciprocated. So, as far as what Megan was referring to, maps are highly discouraged because that just kind of encourages people to understand, like, as locally as possible where things are going on. But ultimately, if it's your agency's data that's reporting it out, you can kind of do with it what you'd like. It's when you're looking at information in ODMAP that's in your region that is not your specific information. So you can always filter by your information and double check, but that's kind of the big sticking point is if it's your information, then always confirm with the reporting agency and just say, hey, we saw a spike. Could we provide more information in our spike alert text message? Maybe pre-establish that relationship and just say, when there's a spike, we'll give you a heads up. We're going to push this out. And maybe come to an agreement on what will be being said. But that's kind of the sticking point is just making sure that if it's your information, then you can kind of do what you want with it, because outside of ODMAP, you could do what you would like with it. But if you're sharing like a regional information, just always make sure that that agency has said okay. So any other questions? I'm sure the data was probably everyone's number one question as far as what can be shared and what cannot be shared. That's something that we've heard pretty consistently as far as reporting out of examples. But any other specific questions, either for myself about the toolkit or Megan regarding the content?
Allie, are you making this available on the ODMAP website?
Yes, so this will all be sent out tomorrow because it's being sent out to everyone that's registered for ODMAP. And then also it can be shared externally with any partners that you guys are sharing information with. And then also it will be posted on the website for you guys to download as much as you would like. And I do ask in return, if you guys start using anything and would like your examples to be added in here for like a second iteration, or if you have found something that's worked really well, please feel free to always like share that with us. We're always curious how people are utilizing ODMAP. And I think now that we're venturing into how people are using it in maybe a more specific way, we're just curious so we can always make this better. We know that this is kind of the first iteration, but there are some things we were talking internally we'd like to see in the next round. Just right now, there's not a lot of research on things like TikTok messaging, but we know that that's something that it's going to be much more, it continues to be prevalent, but it's evolving even more and more. And so we want to see how that might look in the future as well. Okay. And again, feel free if you guys have any additional questions as well. I'll put my contact information in, and Megan, if you want to put your contact information in the chat as well, if there's more specific questions. But our goal really was just to kind of do this as a quick guide, knowing that there are more specific social media toolkits related to public health messaging. So that's where we kind of connect you guys. But this is more focused on how do you take those broad concepts and tailor it to ODMAP. So I know we had an hour on the books for this, but I'm sure everyone won't mind getting about a half an hour back on this Tuesday. But never be afraid to reach out. We're, again, always curious to hear what people are thinking. And if you have any feedback on the toolkit as well, like I said, this is kind of step one. We're always looking to evolve these, but we're very happy and very excited to kind of let you guys have this. And thank you again to Adapt for putting this together. You'll also get a link to the summit that Adapt will be putting on in case this is something the prevention realm is in your wheelhouse and you'd like to get more information on that. Okay, well, I guess we can, Megan, if you're okay with it, go ahead and wrap up for the day, and we can go ahead and get this shared out with everyone.
Sounds good. Thank you so much. I'm excited to see how folks put this to use.
Okay, thank you everyone and have a great rest of your day.